Okay, hello everybody. Today we are going to be talking about substance-related disorders. There are several of these. We're going to go through a lot of the psychoactive substances in order, probably alcohol and stimulants, narcotics, quite a few different categories here. Okay, but before we get started with the specific categories, we're going to talk a little bit about some overall terminology, because you'll see these terms used throughout the rest of the lecture. When we talk about substance abuse, we're talking about excessive use of these drugs. Okay, and it could be licit or illicit. Licit meaning legal, illicit meaning illegal. But excessive use. So you'll see different terminology out there in drug and alcohol studies where it'll say drug abuse, drug use, drug overuse. There's a lot of different terms. Okay, we're going to be using substance abuse. And then substance dependence. This is the physiological need for increasing amounts. So one's body has adapted to this substance coming into it, and so the body is better at metabolizing the substance. There's a lot of different behavioral as well as physiological things that are going on with being able to metabolize and actually act and behave a certain way, even though those chemicals are in your body and affecting your body. And also, if you were to decrease the usage, then your body is going to react in a negative manner. And that's how you know that there is a physical dependence occurring. Okay? When we're talking about tolerance, the biochemical changes in the body, it says biochemical, but there can also be a behavioral tolerance as well. There are those individuals that long-term alcoholics that they still, they stumble a little bit, they feel a little dizzy, but they're able to get through their day. How do they do that? Because behaviorally they've learned how to interact. Their activities of daily living, still continue forward on these with these things, even though the drug is having an effect on their body. And then there's withdrawal, physical symptoms from abstinence. So what I was mentioning to you is that because there is a physical dependence, the body reacts in a negative manner when the drug is no longer introduced into the system. And for the most part, withdrawal symptoms are always going to be the opposite of the effect of the drug itself. Okay, so if you were looking with a CNS stimulant, increasing stimulation, increasing anxiety, that kind of thing, then the withdrawal symptoms would be kind of this crash, okay, where they would sleep a lot and that kind of a thing. All right. Here is your e-lecture topic item, and please fill this out. Describe the following in detail and provide it with your discussion thread for this week. Okay, psychoactive drugs. What we're referring to here are these are only drugs that have a psychological effect. What that means is that these drugs have to pass the blood-brain barrier. They have to have an effect on the brain in order for them to be psychoactive. Some of those, and this is not an exhaustive list, but we have alcohol, we have our narcotics, which we'll talk about all of those, opium, morphine, heroin, codeine, all in one group, narcotics. We'll talk about stimulants, and again, all of those, cocaine, amphetamines, caffeine, nicotine, all under the umbrella of stimulants. We have sedatives, we have anti-anxiety drugs, pain medications, and then hallucinogens. Okay, so starting off with alcohol. Prevalence here, alcohol abuse cuts across all the age, educational, occupational, and socioeconomic boundaries. So it's seen all over the nation. It's seen all over the world. Lifetime prevalence for alcohol in the United States is 13%. That's pretty high. Enormous detrimental physical effects on the body linked to accidents, violent crime. It's more common in men. And more than 37% of alcohol abusers, again, we're using that term there, right? Substance abuse. Abusers suffer from at least one coexisting mental disorder. And what we've termed that is that comorbidity. So there's high comorbidity with mental disorders and alcohol. Okay. Some of these alcohol-related disorders, you have things like chronic fatigue, oversensitivity, depression, impaired reasoning, personality deterioration. Okay. These are psychosocial effects of alcohol abuse and dependence. Biological disorders. Alcohol withdrawal delirium or delirium tremens. And here's one thing to keep in mind is that people think about drugs. Well, in fact, we often say drugs and alcohol, and that doesn't even make sense. Drugs and alcohol. Alcohol is a drug. So why do we minimalize it? It's almost like we want to set it aside. Well, alcohol is alcohol, but it's not as bad as the rest, right? Alcohol is not as bad as heroin. Alcohol is not as bad as methamphetamines. However, more people die from alcohol than any of the other drugs. And primarily that is because of the delirium tremens. You see right down here it says death from convulsions and heart failure can occur. Okay, so alcohol, when used for a long period of time, can be extremely dangerous. You also see disorientation, hallucinations, and that follows with the delirium tremens. There's also Korsakoff syndrome, where there's memory loss, and it's untreated can lead to irreversible brain damage. And Korsakoff's is actually a vitamin deficiency disorder. So these individuals, what they've basically done is replace their normal diet with alcohol, and because they're so depleted of vitamins, that is causing the Korsakoff's. Okay, a little bit more information here. The neurobiology of addiction. Now, I want to go over this. We'll go over it one time here, and then I'll just kind of refer back to it temporarily, because it's the same pathway for all of these psychoactive substances. Okay, but let's pause and go over it now here. You have an acronym there that says MCLP, Center of Psychoactive Drug Activation. That MCLP stands for the mesocorticolimbic dopamine pathway. Okay, the mesocorticolimbic dopamine pathway. And I'll show you where this is in the brain in the next slide. But for right now, just remember this is a dopamine pathway, and some people call it the reward pathway. Okay, this pathway is activated, and there's an increase of dopamine is what we mean by activated. So this reward pathway is activated for any kind of reward. If we're thirsty and we drink some water and man, that was great water, that was part of the reward pathway. If we're hungry and we eat something and we say, man, I feel really good, feel really full, that was part of the reward pathway. Okay. What psychoactive substances do is that they hijack this natural pathway. Okay, so it's no different. People, addicts, they go back to alcohol, they go back to the heroin, the same reason why you and I go back to water and food. Okay, because it's rewarding to us. All right, so that's what we have to remember when we're talking about the neurobiology of addiction. Now, there is a genetic component. There's an alcohol risk personality that some people state could exist, and then also exposure and learning. Right? You grow up in an environment, you grow up with parents that they drank alcohol. All you've ever really seen is that when you're happy, you drink alcohol. When you're sad, you drink alcohol, because that's the behavior that's been modeled to you. Okay? And then down at the bottom, in low doses, alcohol is actually a stimulant. It stimulates the brain, but in high doses, it becomes a depressant. And here is that pathway. Okay, Remember the mesocorticolimbic pathway. Really what this is saying is meso is middle, right? So it's the middle of the brain. That's the red dot, the ventral tegmental area. And then that's going from the VTA, or ventral tegmental area, to the nucleus accumbens, which is more in the area of the limbic system. Okay, and then it moves on forward to the prefrontal cortex, where judgment and reasoning and those kinds of systems work. So that is your reward pathway. Okay, psychological causal factors. Failures in parental guidance, psychological vulnerability, stress, tension reduction and reinforcement, expectations of social success, marital or relationship crisis. You can see how alcohol plays a role in a lot of these factors. So how can we treat alcohol? Well, they use drugs such as Antabuse, which is placed into the system so that if an individual were to consume any alcohol, it would make them very, very sick. Okay. And then there's naltrexone. Naltrexone is used not only with alcohol, but with a lot of these psychoactive substances. You'll also hear the word naloxone, right? And it blocks the pleasure-producing effects of these psychoactive drugs. And then also for lowering the side effects of withdrawal, Valium has been used quite a bit for this. And I'd like to elaborate a little bit more on this by reading this to you. It says, Valium has largely revolutionized the treatment of withdrawal symptoms. Such drugs overcome motor excitement, nausea, and vomiting, prevent withdrawal delirium and convulsions, and help alleviate the tension and anxiety associated with withdrawal. Okay, so Valium has become a key component to working with the withdrawal symptoms. Okay, also group therapy, environmental intervention. These are where there's drug rehab places, right? So that you get out of your environment. It's very, very hard to change. You're trying to change yourself, but everybody around you is still the same, and so it's very, very hard. And then cognitive behavioral therapy. There's aversive conditioning or skills training, self-control, cognitive restructuring, all those things that are also necessary. So it's not going to just be naloxone, naltrexone. That's one thing that you have to remember about this. Somebody is on the verge of overdose and they come into the hospital, they give them the naltrexone, the pleasure's gone. They're like, okay, yep, feel a lot better. That didn't fix anything though. That's not the reason why they're using this psychoactive substance, right? For the most part, yeah, they are extremely pleasurable. Yeah, they're hijacking the reward pathway, but people that become addicted to these substances, there's more to it than that. It's probably masking something else. If you're a very anxious person and you just can't deal with the anxiety, then alcohol will help with that because it's the opposite. It's a CNS depressant to calm you down, right? And so that's where it becomes not only physiologically rewarding, but it's emotionally rewarding, psychologically rewarding, and that's where psychological dependence comes in also. The whole idea of craving, okay? And then just other approaches, everybody's heard of Alcoholics Anonymous, but they're also looking at controlled drinking rather than abstinence. I thought it was fascinating. I was back east a couple weeks ago on an L train, actually, in Chicago, and there was a sign over on the wall, and it said, trying to quit alcohol, and then below that, are you currently a smoker? Oh no, I think it was the opposite way around actually. So it was like, do you want to quit smoking, but are you willing to drink alcohol? And it was actually from a university hospital back there where they were looking at, because nicotine is probably hands down the most addictive substance that we know of, period. I'm kind of getting ahead of myself here, but they're using, they're using another thing like alcohol, right, to try to curb the effects of nicotine. Many of you probably know with Alcoholics Anonymous, one of the things is try to ward off as many of these crutches as you can. Alcohol is your main problem, but these people also smoke. Well, if smoking is your last crutch, then that's at least better than being drunk all the time. So there's a lot of ex-alcoholics or people attending Alcoholics Anonymous that still smoke, right? And again, one's a stimulant, one's a depressant, and they're trying to balance their themselves out. Okay, so that was alcohol. Now on to narcotics. Okay, alleviation of physical pain, relaxation and pleasure, alleviation of anxiety and tension, and then euphoric spasm. These are all effects of narcotics. Now, one thing to remember here also is that a lot of the CIS shows, a lot of the police stations and things like this, you'll see the narcotics unit, okay? Or you'll see the, what is the other one? Is like alcohol, alcohol, tobacco, and something unit. And it's weird how they came up with these different phrases and stuff. But in that case, the narcotics unit, well, they're talking not what we're looking at here, where narcotics are opium and codeine and morphine stuff. They're talking about overall. Narcotics unit is just all of these psychoactive substances. So just kind of keep that in mind, that there's a lot of terminology that's used. Some long-term effects. You have physiological craving for the drug, so that's that physical dependence, causing withdrawal symptoms if you remove the substance from your body, and then gradual deterioration of well-being. How does it work? Well, heroin replaces natural endorphins, and so that's why it's so good with pain. But it also affects the reward pathway. There you go, the dopamine reward pathway. So it's hijacking that, making it very pleasurable for the individual. And addiction results of genetic deviations in the reward pathway. So the idea being here is that there might be a genetic component to this where the reward pathway has just been wired differently in these people that abuse the substance. Okay, comorbidities, 50% have other forms of substance abuse. So if they're abusing Vicodin or something like that, they might also be abusing alcohol. They might also be abusing methamphetamines. 36% have a history of trauma and also linked with depression, anxiety, and other disorders. Treatment here for narcotics focuses on discomfort of withdrawal. So we've heard of methadone clinics. Methadone is a drug that is very similar to heroin, but it doesn't have the same strong initial, effect on the body. So they use the methadone to wean the people off of heroin. All right, now we go on to stimulants. Cocaine and amphetamines. Increase feelings of alertness and confidence, right? They stimulate you. Decrease feelings of fatigue, right? So amphetamines, methamphetamines really speed you up, right? So you're not tired. It's the opposite of fatigue. How do they work? Well, cocaine blocks the presynaptic dopamine transporter. What that means is that it's going to block the reuptake of dopamine in the system, which then therefore provides a lot more dopamine in the system. So it's not being reabsorbed, it's being sent out there into the synapse and it stays out there. So it increases the availability, causes a euphoric state, and chronic abuse leads to hallucinations. Okay. And long-term amphetamine use is psychologically and physically addictive and may result in brain damage and psychopathology. The interesting thing about here is that an individual can come in to a hospital setting, and they can be assessed by a medical doctor or physician, and that physician could think that this individual is schizophrenic. Okay, they're acting like that. They have the hallucinations, right? They're showing this psychopathology, when in fact it's an amphetamine-induced psychosis. And the reason for that is because of the dopamine. The dopamine is working both ways. In schizophrenia, which we'll talk about in another chapter, is this excess of dopamine. Well, with methamphetamine-induced psychosis, it's also this abundance of dopamine in the system. So medications here, again, you have your naltrexone, and then, but that's not going to be a fix. You still have to do the work. You have to do the emotional work, the psychological work. Why are you addicted to these substances? What is it doing for you? You have to restructure your cognitive thoughts, CBT, contingency management, operant conditioning model. These kinds of things you still have to work on to overcome the abuse or addiction. Okay, just another type of stimulant is going to be your amphetamines. Okay. Originally known as wonder pills to stay awake and alert, and they've also been used for quite some time for weight loss. Back in World War II and those times, they would give amphetamines to the military personnel. Hey, stay alert, stay awake. You'll be a better soldier, and they were actually giving them these amphetamines. Now remember, this isn't to the potency of methamphetamines, but nevertheless, causing a stimulatory effect. So abuse leads to hazardous fatigue, psychologically and physically addictive, and then brain damage. Here's the amphetamine psychosis. So I got a little bit ahead of myself on there, but here's the amphetamine psychosis part. And it says leads to hazardous fatigue. What that means is that you're taking the substance, it's keeping you alert, and then, there's going to be become a point where your body can't keep up any longer. Okay. Treatment, the withdrawal from the drug is again going to be the opposite. Primarily here, you're looking at people, withdrawal from methamphetamines, they'll sleep for 4 or 5 days. Okay, it's the opposite effect. It may lead to depression, GI symptoms, personality deterioration. However, did you notice that unlike alcohol, we're not listing a bullet item on here for death. Okay, death due to convulsions, death due to heart failure. Now, there are cases, of course, where people have a heart condition or something like that, and they ingest a stimulant like cocaine or amphetamines, and they die from that because they have a bad heart. But people die because of caffeinated drinks, right? But here, the idea is that we don't have where there's an actual condition that goes along with this psychoactive substance that in withdrawal you can die. Okay. All right, methamphetamine, highly addictive stimulant drug, increases level of dopamine in the brain, and known by some as poor people's cocaine. Okay. Oh, and I guess let me go back to that. That's all we're going to really focus on here, because we still know the same things with the reward pathway. We're still knowing that it's a stimulant. It's going to be affecting dopamine. It's just a very, very high potency amphetamine. Okay. Now, there's also caffeine and nicotine. And I listed it here as illicit drugs, right? Because these are legal. Why are they problematic? Because they're easy to abuse, they're easy to access, they have addictive properties, they're very difficult to quit, they do show withdrawal symptoms, and they have many health problems and side effects. Okay, and like I mentioned before, nicotine is probably the most addictive substance that we know of. Period. Okay, moving right along. What about sedatives? Now here we're looking at our barbiturates. These are CNS depressants. They're similar to alcohol in that way, and once widely used to induce sleep. Now we have other things like benzodiazepines and stuff that are safer, but originally used for sleep. Okay, so barbiturates, they do show physiological and psychological dependence. And the big issue here is this lethal overdose. Okay, what we're talking about here is that because tolerance builds, physiological tolerance, which means that you need more and more of the drug for the same desired effect. Okay, since this is a CNS depressant, you ingest more and more and more of the barbiturates to the point where you had no idea, but the dosage that you just took was the lethal dose for your body. Okay, because you're depressing the central nervous system, you depress the brainstem, and if you suppress the brainstem, then that's where your breathing centers are, and so on, and pretty much the active dose becomes the lethal dose. Okay. Treatments here. Dependence tends to be middle-aged people, and withdrawal is a key treatment issue because of dosage and comorbidity. Right. So again, it's comorbidity with a lot of the other drugs and a lot of other mental disorders as well. Okay. The hallucinogens. Here we have LSD, chemically synthesized. We have ecstasy, you've probably heard about, similar to methamphetamine. Mescaline, which is actually a cactus, it's a plant. Psilocybin, which are mushrooms. And then I put at the bottom, don't forget marijuana. It's also hallucinogen, and probably one of the psychoactive substances that are most well known, and especially with the legalization of marijuana and so on. All right. LSD changes sensory perception. The experiences can be terrifying. They can be pleasurable. There's flashbacks. Popularity has waned, but part of the wave culture. Okay, so LSD is one of those things where it's very, very potent. You can place it onto a stamp or like a piece of paper or something like that, and then just lick it off with your tongue, and then you start having these hallucinations, and it just seems to exacerbate the colors around you, the sensations around you, that kind of a thing. Mescaline and psilocybin, they actually do very similar things, but like it said in the other slide, mescaline is from the cactus, peyote cactus, and psilocybin is from mushrooms. And that's a good way of putting it, is the reality distortion. I talked about the exacerbation, I guess, of different sensory or different physical energies like light or sound or something. But reality distortion is a good way of putting it as well. Okay, what about ecstasy? There's a rush in well-being and serious adverse consequences. Increasingly popular among young adults. You hear about ecstasy in the whole rave culture, right? Going to these different rave parties and so on because of that rush and feeling of well-being, and people are dancing all night, kind of a thing, right? So it's popular for young adults in that way. And then marijuana causes euphoria, increased feelings of well-being, heightened perceptual acuity, relaxation, and hallucinations as well. All right. What about treatment for marijuana? Few utilize pharmacotherapy, so there's not a lot of like the antidepressants that we talked about before, or anti-anxiety drugs or anything like that. Psychological treatments appear to be the best. Okay, and again, it's just going back to, why are you ingesting this substance? What is the substance doing for you? What is it masking, right? Why is it so desirable to you? Okay. Synthetic cannabinoids. All right, these mimic THC, which is the active ingredient in marijuana. Some of the names here is like Spice, K2, Blaze, and these have serious adverse side effects. There's also synthetic cathinones, which mimic cocaine and amphetamines, and these are called the bath salts. You've probably heard about these in the news or so on. And again, serious adverse side effects. Let me give you some of these. The side effects for your synthetic cannabinoids, you're looking at anxiety, tachycardia, that's a rapid heart rate, hypertension, heart palpitations, irregular heart rate, seizures, and psychosis-like effects. With the cathinones, you're looking at increased motor activity, agitation, violence, psychosis-like effects, and heart problems. Okay, it's really that psychosis-like symptomology is really dangerous. Okay, and that's it for this chapter. Thank you.